everyone, and thank you for braving the weather and coming in tonight. My name is Jo Bratali. I'm the Head of Collections here at the State Library. It gives me great pleasure to welcome you all to the Policy Pitch, presented by Grattan Institute and State Library Victoria. This seminar is held on the traditional lands of the Kulin Nation. I wish to acknowledge them as the traditional owners. I would also like to pay my respects to their elders and to the elders of other communities who may be here this evening. I'd like to give a warm welcome to tonight's speakers, Anna Peeters and Stephen Duckett, Grattan Institute members and staff, and friends of the library. It is a pleasure to work with the staff at Grattan Institute to present the policy pitch. This series brings to the library industry leaders who invite discussion about complex public policy issues significant to the lives of Australians. This evening we will explore what can and should be done to address obesity and its effects. The rates of overweight and obesity amongst Australian adults have doubled in the past 2 decades. Despite the plethora of diet information around us, we are now ranked as one of the fattest of the developed nations. We are about to hear about 2 innovative proposals from 2 leaders in the field. Anna and Stephen, I'm looking forward to hearing your ideas for solving this health issue. It's clearly a topic of great concern and interest, and it's very satisfying to see so many here this evening. I'm pleased to now introduce our speakers this evening. Anna Peeters is a professor in the School of Health and Social Development at Deakin University. She is a public health researcher with a strong interest in the provision of information to facilitate objective and equitable choices in public health by policymakers, practitioners, and the community. Stephen Duckett is the Director of the Health Program at Grattan Institute. He has a reputation for evidence-based innovation and reform in areas ranging from the introduction of activity-based funding for hospitals to new systems of accountability for the safety of hospital care. Please join me in welcoming Anna to the stage.
Thanks very much, Jo, and thanks, Stephen, for inviting me. It's a real pleasure to be here tonight. I'd also like to pay my respects to the traditional elders of this land, and I'm looking forward very much to our discussion after the talks. So I guess what I want to talk about tonight, just checking the sound's still okay. What I'd like to talk about tonight, first I'd like to acknowledge my contributors, so people in my group in particular that you'll see in this smiling photo here, and funders, collaborators. So what I'd like to talk about tonight, which then Stephen will follow on from, is obviously, as you know, the problem of obesity. And the reason that we're having this conversation is because over the last decades, obesity in Australia has increased rapidly and greatly. So what this slide shows you is in 1980, about 1 in 10 adults in Australia was living with obesity. With the most recent data in 2014-2015, you can see this has increased a lot to almost 3 in 10 Australian adults living with obesity. But not only is the prevalence of obesity today high, it's also unequally socially distributed, such that if we think about the Australian population divided into quintiles of socioeconomic disadvantage, so it's fifths of the population, and we look at the least disadvantaged quintile, you can see there that the proportion of adults living with obesity in Australia today is just under 2 in 10, or 19%. And you can see that's a lot less than those in the most disadvantaged quintile on the left, where around 1/3 of Australian adults living with the greatest disadvantage today are living with obesity. So there are some really powerful reasons why we need to take this issue of obesity seriously and start addressing it comprehensively. And I guess one of the reasons that we know obesity has been increasing in prevalence both in Australia and worldwide is because of our unhealthy dietary patterns. And one of the big drivers of our unhealthy dietary patterns is today's food environment. Now, I was going to put up lots and lots of pictures of bad food environments, but I thought actually I can just ask you all to reflect on any minute of any given day in your own lives. And you know that whatever environment you walk through, whether it's your train station, whether it's a service station to fill up with petrol, you're confronted very often with unhealthy food choices. And if we think about the imbalance at the moment in our food environment, such that the affordability, the availability, the promotion, the placement are really weighted in favour of unhealthy food choices. And this is across our society, from our children all the way through to adulthood. And this drives both our food choices and then eventually our food preferences. And I thought of a quote that I heard recently from the CEO of the Melbourne Sports and Aquatic Centre, who has recently committed to improving the healthy options there. And he said, "When is it that lolly snakes became the default halftime snack?" And I think it's a brilliant illustration of how our norms and preferences have changed over time. And unless we manage to rebalance these scales and tip all those elements from affordability through pricing, availability, promotion and placement back in favour of the healthy food options, we really won't be able to tackle what are now the normal habitual food preferences in our population, which lead to this issue of obesity. So I guess what I want to focus on, leading up to my policy pitch, is what do we do in the face of this? And it's very well accepted now globally that we need a range of complementary policies to improve both our food preferences and, therefore, the food intake across our population. So I wanted to set the context for you first before both Stephen and I drill down into specific policy areas, because it's very well understood in this area that one policy is not going to fix the issue. We need a range of complementary approaches and policies if we're going to move forward. These range from things like the Live Lighter social marketing campaign. We know that we need evidence-based, effective, integrated social marketing to make the population, to illustrate to the population the risks of unhealthy food intake and the benefits of healthy food intake. In addition to social marketing, we know that we need policies and initiatives around food pricing, and this is both around pricing initiatives such as what Stephen's going to be talking about, so taxes on sugary drinks, but also around things like subsidies to healthy food options. In addition to these strategies, we know that we need strong restrictions on marketing of unhealthy food. And again, this is both in terms of things that we might be quite familiar with, like television marketing of unhealthy food to children during children's viewing hours, but much more broadly to things like digital advertising, both on the computers that our children spend so much time in front of and the apps that are now emerging with freebies from every junk food outlet you can think of, all the way through to things like children's sports, where unhealthy food sponsorship is clearly prevalent. And another large pillar of what is understood to be a comprehensive regulatory or policy approach at the government level is really good food labelling. So again, this is both, as in this picture, the health star ratings, so things like front of pack labelling for packaged foods that you now see on many of the products in the supermarkets, right through to point of sale labelling. So that's like the kilojoule labelling at the fast food outlets that we're now going to see throughout Victoria due to recent legislation. So we know that we need this range of comprehensive government approaches to change basically the food environment that we live in across all those elements I outlined before. And at the same time as we do that, we need to build the skills and education of the population in order to make those healthy food choices, prepare the food, as illustrated here with the Jamie Oliver Ministry of Food, to understand and appreciate healthy food, as you can see here with the famous Stephanie Alexander kitchen gardens, and also to understand what might be good food practice, both for ourselves but also for our children. So as I said, this is a very well accepted platform, and what I really want to focus on is the gap that I've explicitly left in the middle, which is what I see as the opportunity for policy and intervention to come from community and community organisations themselves. So my policy pitch is how we might think about implementing a healthy food policy for food service retail across our communities. And my pitch is that we start from all government and community settings, and this includes things like local government, parks, sports and recreation, hospitals and universities. And the reason I think these are the best food service outlets to start with is because most of these organisations have overarching goals that are consistent with healthy community goals, and that clearly aligns with healthy food service retail. In addition, they have amongst them large population reach, and if we can manage to illustrate in these settings, which have these consistent organisational goals, that implementing healthy food service retail is feasible and effective, then there's a real opportunity to both set population preferences across those settings and also to lead by example. So that's the basis of my policy pitch. Of course, there are lots of potential hurdles to implementing healthier food service in retail settings. And although it's often consistent with organisational values across these settings, there are lots of questions around how can I implement it? What should I be implementing? Is there really a health benefit if I change all the food and drink that I provide to my customers? And will it negatively impact my business? And I guess what I want to expand on in today's talk is it's really important that we start to answer these questions from the perspective of those that we are asking to implement these policies. And unless we can align those, it's actually very difficult to move forward. And so that's what I want to do. I want to kind of talk to you about what I see as a really exciting opportunity in Victoria at the moment, where we're getting a groundswell of change across a number of these organisations that enables us to answer some of these questions. And one of the things that has really supported this groundswell is that we have developed from the state government, there's been the development from the state government of a series of policy documents and resources that I would argue are now becoming the policy backbone of this change. And these range from things like policy outlines, so these are actually policy documents that you can find on the state government's website, around how to change to healthier food service retail for parks, for sports and recreation, for hospitals, so for a range of government settings. Alongside that, they have a categorisation and classification guide, which indicates how we can actually classify foods to enable this change. And their highlights are a traffic light system, so you can see green, which is, as you can see, best choice, amber, choose carefully, and red, which is limit. And there are guides on how to make these classifications according to nutrient and energy categories. And finally, they've developed with Nutrition Australia a resource base called the Healthy Eating Advisory Service, which enables support both for the classification of foods and also strategies for change. So this is a kind of a policy backbone that I think you need, and a resource backbone that you need to support a change like this across multiple organisations. At the same time as this has been emerging, over the last 5 years, we've also seen really exciting leadership from a number of our community organisations. And I just want to really briefly show you how this is emerging over time. And thanks to Tara from my group who put these slides together for me. And what this shows you, all these stars basically indicate Victorian organisations that have started to take action to reduce the sales of sugary drinks from their settings over time. And some of these leaders included names you will have heard of, like YMCA Victoria, Alfred Health, City of Melbourne, City of Geelong. And so you can see that we're starting to get really good spread over the last 5 years of organisations saying we're going to change what we provide our customers to healthier drink options. Then in the last 2 years, this has rapidly expanded. And here you can see both individual organisations like the Melbourne Sports and Aquatic Centre that I spoke of before, like the Comprehensive Victorian Cancer Centre, and also those red dots, a whole series of hospitals in the Greater South West Hospital series. So you can see that by a couple of leadership organisations making movements in this area, we're getting large coverage across the state. And my guess is that in 2 years, we'll see a doubling of the number of stars. So we've capitalised on that opportunity, and with a whole lot of partners that you can see here, we've basically been trying to build the evidence base from those organisations that have been implementing change to address the questions that I was alluding to earlier. So I want to take you through 2 really quick examples that start to touch on the evidence for change. One is from Alfred Hospital. So just to take you through this, and thanks to Oliver Hughes, whose study this is, basically what this shows you, if you look at the left-hand bar, these are the number of cold drinks sold in one of the cafeterias at a major public hospital in Melbourne. And you can see that the green, amber and red indicate the distribution of the drinks sold according to the traffic light classifications I alluded to before. And what you can see is that around 40%, so if you look at the left-hand column, around 40% of drinks sold were of the red or unhealthiest or limit variety. And so through consultation with the retailers, what this hospital provider worked out was the retailer said, I've got a really good strategy. I don't want to remove choice. What if we put the red drinks or the unhealthy drinks behind the counter, out of sight, so they're not prominent for the customer? If the customer asks, we'll give them to them. We're not going to tell them about the change, and we'll see what happens. And they were fairly sceptical that it would have any impact whatsoever. But in fact, what happened was on the right, you can see that the sales of the red drinks decreased rapidly, so from about 40% of overall drink sales down to 10%. At the same time, you can see that the top of these two bars, the two columns, is about the same. So there was no change at all to overall drinks sold from this particular retail outlet. So the retailer had managed to achieve his health intent without compromising his business intent. A second example is from YMCA, and thanks again to Tara for this one. And this is similar, but as pie graphs. And what you can see in terms of the 2013 pie on the left and the 2014-15 in the middle, that was sales as usual across YMCA centres across Victoria. And again, you can see that the proportion of cold drinks sold that were of the red or limit or unhealthiest variety were between 40 and 50%. They took a different path. They decided they were going to remove all soft drinks from their centres. And so any of you who have been to YMCAs over the last year will probably, or maybe not have, noticed that they no longer sell soft drinks. And so the consequence of this you can see in the 2015-2016 pie graph, because they had all been removed by that summer. And again, you can see that the proportion of drinks sold of the unhealthiest variety dropped a lot, in this case to around a quarter. So the red drinks remaining were things like sports drinks, which they've now undertaken to remove over the next 12 months. What you can't see, I don't have these as bars, so what you can't see, because it's still preliminary, is that so far Tara's analysed 9 of these centres and there's no evidence of an overall decrease in drink sales from these cold fridges. So it looks like a very similar story. They chose a strategy, they were able to implement it across all their sites across Victoria. It had the intended potential health effect of decreasing purchase of unhealthy drinks, with no apparent impact on sales or, in fact, customer feedback, which we've also done and I can talk about later if you like. So, just a few quotes as we wind up, because I think it's important to hear this from the retailer themselves. And we've interviewed, and that's Miranda as well up there, who's also done work with different retailers in Melton and Wyndham and Alfred. So I just want to read you these 3 quotes from different retailers in different settings, who've all undertaken changes to healthier food retail. You can see it working, and you can see lines at the salad bar at lunchtime, and you can see that the hot fried side's not as busy. It is going really well. The feedback is quite positive from staff, customers. It hasn't impacted the revenue stream in a negative way. So clearly these are 3 quotes out of many, but the point I really want to highlight here is along those 3 questions that I raised before, in terms of feasibility, potential for health benefit, and potential negative impact to the business. We're seeing really common themes coming out. Of course, there are complexities and hurdles, and I would like to mention them before I end, so you don't think it's all easy. But clearly, we're at the start, I think, of a really significant journey. So some of the implementation challenges I think it's worth touching on, because I think that's where the policy kind of advance is going to come. There's really limited supply of healthy alternatives in certain categories. And so the more that we can work in a strategic way to boost that supply side, the better it's going to be for customers and business to participate in healthy food service retail. It's complex to work out strategies tailored for every specific site and setting, and that's where we hope development of case studies is going to be really valuable. At the moment, there is the lack of a level playing field because these policy guidelines are voluntary. We are relying, as that last point says, on strong leadership, capacity, resources across specific organisations. And that is meaning that at the moment it's not a level playing field, and that can be a real barrier for new organisations to move into the space. And we can talk about all that in the discussion as well. So to summarise, I think if we look at what the key hurdles to implementing healthy food service retail were seen to be when we moved into this space a few years ago, and as the organisations and government really started in this space probably about 5 years ago, I think we're getting lots of good examples now that implementing healthy food drink policy at least, and we're getting emerging evidence now around food, is feasible, and all the examples I've illustrated today are ongoing, so they're clearly feasible in an ongoing and sustainable sense. That they have the intended effect on purchasing, so that is customer potential health benefit down the track, and they seem to be acceptable from a business perspective, both financial but also retailer and customer satisfaction. So I guess my policy pitch is that we start to fill in this middle ground in terms of our approach to obesity prevention. And in addition to having sort of a growing policy and resource infrastructure in the middle there, I think it's really important that we start to link it both down so that consumers have really clear information about what's happening in these settings and why, and are able to feed back, and also up so that we perhaps have stronger policy coming from government around monitoring and incentives so that we can start to make it a much more level playing field. So thank you very much. I'd like to... And now I'd like to invite Stephen.
Thanks very much, Anna. And I'd also like to acknowledge the traditional owners of the land, the Wurundjeri people of the Kulin Nation, and pay my respects to the elders past and present. I'd also like to point out that Aboriginal people today have a life expectancy about 10 years shorter than non-Aboriginal people, and they have much more exposed to some of the problems that we're going to be talking about today. So when we hear those acknowledgements of country, we should also be thinking about what the implications are for what we are doing. I'm going to talk to you today about a report we released late last year, which proposed a sugary drinks tax. I've got copies of the report here. So the people who ask the best questions later on in the evening can come up and get one of the 5 copies that I've brought with me. I'd also like to acknowledge Trent Wilshire, who is the associate who worked on this report with me. So Anna has covered the background quite well. You've seen she showed data about the significant increase in obesity that's occurred in adults. This slide also shows a significant increase, a much greater proportionate increase in obesity in kids. So from around 1% or so back there in the mid-80s to about 7% now, the same 10 to 30 or so increase for adults. And so obesity is a serious problem. We conceptualise the obesity problem as causing problems for two different clusters of interest. One is the people who are obese. They have higher rates of admission to hospitals. They're sicker population generally, or greater risk of a number of diseases. But also there's a problem for the taxpayer. That is, the consumer consumes the sugary drinks or whatever, but the taxpayer who doesn't consume the sugary drinks or whatever ends up footing the bill for that obesity. So we, using data from PwC, I think it was, analysis, estimated the cost of obesity to the taxpayer of more than $5 billion a year, about $5.3 billion a year. Now, some of this is because obese people have a greater tendency to use GPs. As I said, they're more likely to be sick than non-obese people. They're more likely to go to hospital. They're more likely to use pharmaceuticals. And so those direct health costs add to about $2.5 billion a year. On top of that, they're less likely to be in employment, even after you standardise for socioeconomic status, less likely to be in employment, and so the taxpayer loses out on not getting income tax from their employment or reduced income tax, and they're more likely to be on benefits. And so you can see that this adds up to about $5.3 billion a year. About 10% of that we estimate to be related to sugary sweetened beverages. So sugary sweetened beverages the consumption of sugary sweetened beverages costs the taxpayer about $500 million a year, about $500 million a year or so. Our argument was that we should recoup that $500 million and give it back to the taxpayer, so that when a person consumes a sugary sweetened beverage, they get the benefit from that, and they also bear the cost of that, but the taxpayer doesn't bear any costs of that consumption. Now, as I said, this will have sugary sweetened beverages we estimate to be about 10% of the cause of obesity. More than a third of Australians' daily energy is derived from discretionary food, some of which are sugary sweetened beverages, and in the younger age groups, quite a significant proportion. And for, again, for teenagers and young adults, a significant proportion, almost 30%, 25 to 30% of their added sugar intake comes from soft drinks. So if we can change the consumption of soft drinks, we change dramatically the added sugar in people's diets. So I've said that. So, in brief, we recommended a tax on sugary sweetened beverages, and there are a number of ways you can design such a tax, but we said basically there should be a tax based on the added sugar. So that meant that we only focused on drinks which had added sugar. Now this was the sugary sweetened beverage, so fruit juice, for example, which has a high sugar content in some cases, doesn't have added sugar, it's naturally occurring sugar. We also said, one of the reasons for focusing on sugar sweetened beverages was that essentially they have no nutritional value, that they're basically just the added sugar, and so they're empty calories, and so we could focus very clearly. If we'd broadened our approach to include other unhealthy foods, such as all those in the red list that Anna showed us, then you've got a problem that some of those have a nutritional benefit. Chocolate milk, for example, has a milk benefit as well as the disbenefit. Because we're taxing added sugar, it was simple and easy to categorise. So it was a simple tax to design. Now, what's important about the argument I'm putting tonight is that this is not a nanny state argument. The nanny state argument is this, that we, the bureaucrats, or we, the politicians, know better than you about what you should be consuming, and we're going to tax it so that you don't consume as much of it. We're not putting that argument. Rather, we're putting what economists might call an externality type argument. That is, your consumption is causing costs for other people. We therefore want you to take that into account. So we want to put those costs back onto you. So we're not attempting a nanny state. We're not attempting to say everything that you do is wrong, you've made poor choices. There may be poor choices, but you've made them and you bear those costs. What we're saying is we don't want to have the taxpayer bear those same costs at all either. So it's quite a different argument, and it is from what has typically been put in the past. What was interesting, as we were doing this study, we found we had this table, which is those countries or jurisdictions that have introduced a sugar-sweetened beverage tax. And so we've got a list here of those that are in place when the report was produced, and a list of proposed taxes as well, and what the basis of the tax is and how it's structured. What was interesting about that table is more or less every week, or actually about every fortnight, we had to add another line to that table. More and more countries are introducing, or more jurisdictions are introducing sugar-sweetened beverages tax, and you'll see that a whole cluster here in the United States were introduced in 2017. These were by plebiscite at the same time as the presidential election. So the American people got the benefit of Donald Trump, and some of them also got the benefit of a sugar-sweetened beverages tax as a result of what they did that day. Now, what's interesting, you'll see here that the United Kingdom has a tax that's coming into effect in 2018. And it's a tiered volumetric tax. It's a tiered tax. You've got two different rates you see here, 18 cents in the pound and 24 pence in the pound for different levels of sugar consumption. What's happened, this tax hasn't come into effect, obviously. It comes into effect in 2018. But what's happened is Tesco, one of the biggest retailers in the United Kingdom, has changed its formulation of its home brand drinks as a result of that proposed tax. So it's brought down the amount of sugar in the tax because of in their sugar-sweetened beverages because of that tax. So this is really quite interesting. It's the effect of a tax before you have the tax. And this is exactly what you want. You want the changed formulation. So our proposal was for 40 cents per 100 grams of sugar, levied on the manufacturers, on the sugar content. We estimate that a tax of that size would also have an impact on consumption, would reduce consumption by about 15% based on estimates from other surveys. And in the first year would yield about 500 million to recoup the costs of the sugar-sweetened beverages cost the taxpayer. But because of the drop in consumption in latter years, the tax would raise 400 million. I shouldn't say only. 400 million is a fair amount of money anyway. Now, despite the evidence that Anna has just showed you, that people actually do change their consumption patterns with food placement and other strategies, a lot of people say, oh, sugar-sweetened beverage tax doesn't work. That's not the overseas evidence. Sugar-sweetened taxes do work, and I'll show you. There's minimal substitution to other junk foods. Low-income households reduce their consumption more than high-income households, and there'll be a very small reduction in obesity prevalence in Australia. Partly what we're trying to do is stop the increase in obesity. This is from a Californian study. I've used this rather than Mexico because California is more like Australia than Mexico is. And what we have here is Berkeley. For those of you who know the San Francisco Bay Area, Berkeley's on the other side of the bay from San Francisco, and it's connected by trains and cars and all sorts of things. So you'd expect to have spillover effects where people can go and buy their drinks in San Francisco or Oakland, if you want to go to Oakland. But what we have here is that what happened with sugar-sweetened beverages, there was an actual decline in the consumption in sugar-sweetened beverages before and after the tax. And when they looked at comparable counties, there was basically no change in the sugar-sweetened beverages. On the other hand, water consumption went up dramatically, bottled water amongst other things, and it went up in the other places. So basically what we're showing here is yes, the tax reduced sugar-sweetened beverage consumption, and often the substitution was to water. Interestingly, the biggest Coca-Cola also own Mount Franklin mineral water. It is unclear to me where they make most profits, whether from Coca-Cola or from mineral water, but you can see that the company itself would be able to make products from the substitute as well as from the Coke. The effect of our tax would have put up the price of a soft drink can by about 15 cents, 2-litre bottle by about 80 cents, and so on, and a 1 1/4 litre mineral water by 35 cents, and so on. So there would be a small, noticeable increase in the price of those products. People have criticised sugar-sweetened beverages tax because they are regressive. That is, people on lower incomes pay a higher proportion of their income, would pay a higher proportion of their income on the tax than from people on higher incomes. That's partly because of differences in consumption patterns. So what you see here is, even though people on the lowest quintile spend less, this is on total beverages, not just sugar-sweetened beverages. There is a increased spending as you go up the income gradient, but there's also, this is what proportion of household income is spent on beverages in total, and you can see a negative gradient here. That is, lower income households spend more on on beverages of all type than higher income households, and so you could say that it is going to be regressive. However, you do need to look at the values over here. This is 0.75% of household income compared to about 0.45%. So what we're talking about is 0.3% on beverages in total. So sugar-sweetened beverages, possibly about half of that. So we're talking about 0.15% of a gradient. So yes, it is regressive, but the gradient is very, very small, and it's very small proportion of household income. So it's a trivial proportion of household income. As a result, organisations such as the Australian Council of Social Service, ACOS, ended up supporting a sugar-sweetened beverage tax. So we released this report late last year, as I said. We got some nice publicity in the Financial Review. Would raise $520 million and cut obesity, a positive article. On the other hand, in the Australian, they weren't so positive, saying there was a fat chance a sugar tax will reduce obesity. This guy also claimed that obesity isn't related to health problems either, which was also interesting. And the Deputy Prime Minister and the Assistant Minister for Health came out and said there was a stupid idea to tax sugar or of any kind, and that is unrelated, of course, to the fact that the National Party represent sugar seats in Queensland. And it's interesting, when this story was, I forget what newspaper it was, but you can see the ads for not necessarily healthy products there. So Barnaby Joyce referred to the tax as bonkers mad, which I thought was a claim to fame. But interestingly, the Treasurer didn't actually rule it out, nor did the Labor Party. I don't think it'll be in this coming budget, but it certainly, if they're looking for budget repair, 500 million from a sugar tax would seem to me to be a place they could look rather than some of the other places they're looking. So anyway, that was where we've got to. That's the report. As I said, we've got copies, and we're happy to answer any questions. Thank you very much. So it's now over to you. You can ask questions of us both or questions of either of us, but we're in your hands. Down the front there.
One of the many socio-economic problems which we and the developed world have is gambling. I see the parallels between excessive use of indulgence in food and with it obesity, and probably sugar being a major contributor, as comparable to the problems with gambling. And I don't see how you're actually going to overcome these. People will do what they want with their freedom to exercise, how they spend their life, what they eat, etc., etc.
So yes, we agree with you. I mean, people should be free to spend their lives, free to do whatever, within reason, of course. But that was not what we argued. What we argued was, yes, they can make those choices. Yes, they can gamble. Yes, they can consume sugar-sweetened beverages. But they only bear some of the costs themselves. An economist would argue, a neoclassical economist would argue, that when you make those choices, you are taking into account the health impacts 10, 20, 30 years into the future. Well, of course, people don't, but that's what an economist would argue. And then they would say that you've made that choice, it's a rational choice, you've decided the benefit you get today is worth the cost you're going to incur tomorrow. However, what we're arguing is when you make that choice, you're also causing costs for the taxpayer, and you're not taking those into account because you don't bear those costs. We want you to bear those costs, hence that's why we've proposed the tax. But I agree with you.
Can I add to that? I guess from a broader policy perspective too, I think that's kind of why I put those scales up, because I think at the moment the food environment is out of balance, so that there aren't the same kind of promotions, pricing structures, availability of all the healthy foods. And interestingly, a lot of consumers want that reorientation because they feel that then they, and particularly their children, might make different choices. And examples came from when we were interviewing people at YMCA. A lot of the parents said, oh, we really like these changes because now we can go via the cafe. Because when we went via the cafe before, our children would not relent until we bought something unhealthy, and we don't want to. So I think that it's a bit more nuanced than that as well, that in fact a lot of consumers might make different choices if we had a different choice architecture.
And what was interesting is when we released this report, I did a fair amount of media that day, including on 2 big talkback programs, including Alan Jones in Sydney. And I was expecting to be attacked and so on for the nanny state argument. But in fact, they supported this approach. I think because their listeners also supported it for the reasons Anna has outlined.
Sorry.
Sorry?
Just a quick question leading on from that, the socioeconomic. Do you guys do much work in the area of education so people actually understand what's healthy and what's not, considering there's so much different opinions in the media nowadays? And also, have you done much with looking at the labelling itself? There have been issues with the 5 stars, for example, that some things that aren't so healthy have got 5 stars, whereas nuts have got 1 or 2 because they're seen as fatty.
So I don't personally work in education or social media, but there are a lot of people in the audience that I know do and may want to comment. But I guess the big picture response to that would be twofold, that I think there are quite a lot of people working in that space and there are some good government initiatives. So like I put the Live Lighter up there for social marketing and education. There are some good skill building programs like the Jamie Oliver Ministry of Food, like the Stephanie Alexander Kitchen Garden. So I guess from a policy, I think there's a lot of good strategies and approaches from a policy perspective. I think the way forward is to make those things more joined up, and I guess that's what I was trying to argue at the end. I was trying to do something creative with chains and lines, but couldn't. But I think that the more we can kind of join up the top-down policy response with the individual education information and then the sort of community level changes, it'll be critical. So just really briefly, one of the responses we had from one of the local governments in a more disadvantaged community that is changing its sports and rec food environment was, now we need to do our own targeted social marketing so our customers understand what we're doing and why, and can actually influence how we do it. So I think what you're pointing to is really critical, and I think there are some really good things happening there, and I would probably argue we join them up as much as possible.
So can I just follow up that, Anna? Do you know if those communities which are adopting healthy city policies or whatever they are, do they face much resistance locally to what they're doing?
So I think it varies. It's probably too early to tell, to be honest. So all the surveys that we and others have done have only detected customer support, overwhelming customer support. However, I think in some of the suburbs now where they're trying to make the changes, they feel like there's going to be more pushback. We haven't seen it in the sales yet, but we haven't done the customer surveys. So I think that we don't know yet.
Thank you very much. You've obviously created 2 classes here, the good drinks and the bad drinks, and you're talking about taxing the bad drinks rather than just using methods such as marketing options, which Anna has described amply. So obviously you've got choices. You can either tax the bad drinks or you can reduce the tax on the good drinks. Now, drinks that have labour input, have value added, are subject to GST. Have you thought about GST exemption? And also, no one has mentioned the bowl of sugar in just about every cafe that is there. So are you proposing some sort of even higher tax on a packet of sugar from the supermarket?
So we didn't. We focused very, very closely on sugar-sweetened beverages. Partly because the narrower the target you have, the clearer the argument is. That is, there's no real nutritional value from the added sugar in sugar-sweetened drinks. Also, it's not quite fair to say that we identified bad drinks and good drinks. What we did say is that the tax related to the amount of sugar. So the more sugar you had, the more tax you paid, and the less sugar you had, the less tax you paid. So it was a sliding scale, not a all or nothing in the case of sugar-sweetened beverages. I accept that, say, for fruit juice, that was out of our scope. When we started this approach, we also thought about the issue of the GST. We, in the end, didn't go down that path, partly because of complexity reasons, because what we're proposing is a tax paid by the wholesaler, not the tax paid by the retailer. And the GST exemptions for fresh fruit and so on are quite complex to administer locally. However, what we couldn't find... We tried to get some data on what was the change in consumption patterns with the introduction of the GST and the change in relative prices, but we actually couldn't get the data, so we couldn't model any of those effects, which is why we didn't go down that path. Others have proposed that the revenue from a sugar tax should be used in part to subsidise healthy choices.
Yeah, I was just going to say that same thing. And I think there are some good modelling studies that show that if you can both increase the price on things like sugary drinks, but then also offset the high prices of things like fresh fruit and veg, particularly in our regional and remote areas, then you do get a much greater benefit. And your question made me realise I didn't answer the last part of your question, which was about, any categorisation system essentially is imperfect, and what do you do about that? And I guess my sense is that at the moment, I think we're, as I said, at the start of what I think is going to be huge policy change globally over the next 5 years. And so I suppose what I'm looking for is real leadership from government and community to say, we are going to make a stand, we're going to shift everybody's preferences to healthier food in all the ways we can. So I think implementing a labelling system that's front of pack and fairly clear is a really strong and good step, which doesn't mean the classification is perfect in any of these systems. And so I think then it's everybody's job to try and work to keep refining them to make them as credible and usable as possible.
Yes, my question's for Dr. Duckett. Just in relation to the calculation of the tax, is that benchmarked against other, like more healthy drink prices? And I guess I'm interested, if people are switching on price, what is really stopping manufacturers of healthy drinks increasing the price, or is there any evidence that that happens?
So there are two components to the question, isn't it? It's the evidence we've had in other countries where a similar tax has been introduced is that the manufacturers pass the cost on, so the price goes up. We haven't seen in other countries, sometimes they've introduced a broader tax across a range of products, so not only the narrow target we have, so we can't actually use the price changes in other drinks to model what happened. I mean, just speculating, I can't see why fruit juice people would increase the price of fruit juice just because the price of Coke has gone up. I don't see why they could increase it in the hope of getting more profit, but that might influence the consumption of their product rather than people who didn't put the price up. So I think the market is such that they probably wouldn't increase it, but we don't have any evidence either for or against that. What was the other part of the question? Oh, why are people switching? Well, yeah, obviously a price affects, if the price goes up, the consumption of that particular product is likely to go down just because of a price effect. We also think it would be valuable to label the drinks that have got this tax on it, so there'd be a signalling effect on top of the price effect. So it would be a doubling, in a sense, of the food label warning on this. So we were hoping. So in the report, I think we recommended a signalling, a labelling effect as well, so people would become much more aware that this is a taxed product, an extra taxed product, I should say.
Yeah, just to support that, so one of the students in my group, Miranda Blake, has done a study to try and dissociate those two effects, which obviously it's hard to do in the real world. So this is like an online panel with both price changes but also information. And it appears that those two effects are independent but accumulative. So they both contribute.
Hi. If this tax were to be successful, do you think it would be possible to apply it to other food products that are considered unhealthy? And if so, which ones, I guess, would be next on the list?
So we thought about this obviously as a precedent-setting approach, because we think it has merit in other areas where we want to be changing behaviour and increasing revenue at the same time. Obviously, other countries have broadened the sweep to include other sorts of beverages, including Diet Coke and those sorts of beverages. They're not in our list. And so sweeping it across to other beverages would be probably the next way you could do it. The problem with that is with sugar-sweetened beverages, we can say this is what we want to reduce, the sugar content, and we've got an unequivocal measure of the sugar. Once you sweep it, once you try and extend the remit of a tax, what you've got to do is say, we want to measure, in a sense, what the contribution of that product is to, for example, obesity, and then you've got to say, we've got to be able to have a measure of working out how much chocolate is bad versus how much milk is good, or whatever it's going to be. So you need an index that you can use, you can point to, and then apply a tax to that index. Such an index doesn't exist as far as we're aware, but that's conceptually where you want to get to. So, yeah, so yes, you can think about extending it, but I'd like to get this one in first before we talk about the extension. There's one in the middle there.
Hi guys, and thank you for cogent presentations. I thought that both of them contained within them an assumption that consumption of these sorts of drinks and foods was kind of ultimately a product of dysfunctional personal decision making. And I think if you accept that, then you accept nudging and choice architecture redesign as fundamentally, correct solutions or partial solutions. But if you, and there's clearly a lot of conjecture about the origins of obesity, but if you accept that it's a more sociologically based phenomenon that has, particularly in poorer areas, a lot to do with depleted communities and depletion of institutions and norms. If you accept that, and if you look instead at things, and Anna, I know you mentioned this in your presentation, the astonishingly high prices and scarcity of healthy, fresh foods in regional, remote and low SES areas in the supermarkets out there, because, obviously these foods are perishable and they're more expensive to produce and transport. If you accept that the origins and the causes of obesity are in significant dispute, might that change the implications of your analysis?
Look, I think that's a really important point. So I don't think it changes the implications, because I guess what I was trying to argue, and I agree with you, I haven't kind of put all those sort of broader social determinants up on any of my pictures, and they clearly do play a role, and I think that's a really important point. But I guess the broader point I was trying to make is that I think we know that we're going to need to do a multitude of different things, and that they are going to be things that happen from the top down at the individual level, and then also at that community level. And so I didn't talk about all the many things you can do at the community level, but definitely there's a lot of fantastic work going on where people are going out to different communities and asking, what is it that you think would make a difference for your obesity rates, and getting a real variety of results, not all of which are on those pictures. So I think you're absolutely right. I guess what interests me is how do we engage all the different actors we need to engage and try and connect them as much as possible, so that what we're doing is synergistic rather than sort of lots of different things happening at once. But I think you're totally right.
So we don't claim that a sugar-sweetened beverage tax is going to fix the obesity problem. That's not our claim. Our claim is that obesity is rising and the current strategies don't seem to be addressing that, so you need to have new strategies. So Anna, in her presentation, said that the right answer is multiple strategies. We're proposing that one of those strategies is a sugar-sweetened beverage tax. We were worried about the regressive impact of this, and you're right. I agree with you that there are a whole cluster of factors which are partly community factors, partly broader societal factors about the obesogenic environment, if you want to use that term, that impact on personal choices and peer choices. We basically didn't address that, partly because it ended up too complex, partly because the report would then end up as a report about obesity with multiple strategies, and we wanted to have a targeted, more focused report to highlight the impact of this one strategy as an additional strategy. We did in the report canvass some of the ways in which you might spend the money. We didn't actually make any recommendations about that, but it is certainly true that every time any country or jurisdiction has introduced a tax of this kind, they've allocated the revenue to addressing some of the issues that you've raised, and or to develop obesity programs in schools.
Hi, I have a question about the barriers to implementing this kind of policy. So often in the research, or the research will have been around for quite some time, that there's some policy suggestions, and before the time between when those policy suggestions come out in the literature and when they're actually implemented into, I guess, government policy, there's quite a lot of time. So I'm just wondering what kind of momentum and what kind of support is needed for this kind of policy to take place in Australia.
So we weren't the first people to propose a sugar-sweetened beverage tax in Australia. There are a number of people who have done that. What one of the things Grattan did was to reframe the argument to try and address one of the criticisms of a tax of this kind, which is the nanny state argument, and also to quantify it, although others have done that quite well as well. We also focused on trying to get political support. We released this report at Parliament House, and it was the meeting was sponsored by a person from the Liberal Party, a person from the Labor Party, and Senator Di Natale, the leader of the Greens. So we had tripartite support for this proposal from those individuals. In the case of Labor and Liberal, the Greens have adopted a somewhat similar policy at the last election. So what we were trying to do, and as part of our release strategy, we briefed politicians and bureaucrats about this to try and win them over to this sort of approach. The best we could do with both Labor and Liberal was not to rule it out, although Barnaby Joyce certainly made his views about it clear. But with all of these things, you don't expect someone to adopt the policy the day after the report is released. It's a slow burn, and it's also keeping the pressure up. And there are a number of organisations such as the Obesity Coalition who are continuing to support this, and more or less every month or two a new organisation comes out and endorses a tax on sugar-sweetened beverages.
Actually, I was actually going to ask something similar. So, just in terms of how likely would it be for this policy to actually happen, given the vested interests and the current political climate?
Yeah, we did some work trying to neutralise that. The argument from the National Party is that they didn't make this explicit, but their argument is it's going to destroy the sugar industry. We actually did some work on modelling how much impact it would have on the sugar industry. Sugar is a world market. It would divert 2% of Australia's sugar production from domestic consumption to overseas sales. So it's a very, very small proportion of the sugar industry would be actually impacted by this. When you think about it, not all sugar is used for sugar-sweetened beverages, and not all sugar-sweetened beverages will cease production. So, you know, it just works its way down, and so is not significant. Notwithstanding that, there are a number of lower house seats which are sugar impacted, including Christensen's, and so, you know, there is obviously a politics associated with it. I don't think either party would go to the election with this as a promise before the election for that reason. However, it's one of those sorts of things that we can hope will be implemented when they look at the budget bottom line.
Can I just add to that? I mean, I think both touching on your question and your earlier question, I mean, I think that clearly to get some change, you need a momentum or a groundswell, and I think it has to be iterative, right? Like individuals and communities need to want something, and then that filters through organisations, government has to want it, and there's a cycle that goes on all the time. There's lobbyists, there's lots of actors. But I think what is exciting, I'm probably slightly more optimistic than Stephen, not that it will be in the next budget, but I think we will see a sugar drinks tax or something similar probably in the next 5 years. And I guess the reason I think it is because I think we're seeing that momentum changing. As Stephen said, you know, every week almost a new sugary drinks tax is announced somewhere in the world. And on top of that, as you said, in the newspaper, we're starting to see it as a really like, well, yeah, of course, why wouldn't we consider a sugary drinks tax? Whereas I can tell you 5 years ago, it was not on the table. Like that, you would be laughed off this stage if we were talking about it. Whereas now, in much more popular media, you're starting to see it as, well, it's a pretty sensible suggestion. Now we just got to see how to get there and work with the lobby groups. And that's such a different framing. And most recently, so the healthcare services that I put up as one of the batches of stars in the southwest, so they've decided to take action in their local communities, which actually also links to your question. They were asked, what would you like to do in your communities? So they're acting across lots of different kind of social determinants of health areas. But they said where we can act is to take sugary drinks out of our hospitals. So we're taking them out. We're making a leadership stance. We're starting a petition for a sugary drinks tax. So it's got nothing to do with their healthcare network, you know, ostensibly. But they now see that as a natural consequence of their leadership for their community and their community's health. So I think we're seeing really, I think, pivotal changes in community sense.
Yeah, when you look back at the cigarette case, there was state experimentation, Victoria, in fact, being one of the leaders in this area. Unfortunately, the law changed, and so you can't have state experimentation on sugar-sweetened beverages tax, or so I thought. So when we were writing this report, I desperately wanted to be able to say, this is a state revenue source. And I spoke to 2 lawyers, and basically the answer is no, it constitutionally is not possible. However, since we've written the report, I've had further thoughts on that issue about how you could actually get state experimentation. And one of the ways I think you could do that, and I haven't got around to writing an op-ed on this, but one of the ways you could do that is payroll tax. Payroll tax is a state tax. And you could go to Coles or Woolies and say, look, we'll discount your payroll tax if you do something about healthy options in your supermarket or something like that. So you can think about a structure which would put a financial incentive on those big retailers and would be for states to implement. So you might get some experimentation. But anyway, as I said, I thought about that after we'd written the report, but you know that's always the case with these things. Someone over there.
It's Lynn Roberts here. Is that on? That was exactly the point. That's what happens when it's 15 minutes before you get to ask you a question. I was really interested in actually asking you, Stephen, about what is the chance of being able to leapfrog from a state-to-state perspective, particularly when you look at that list that you've put up of jurisdictions which are a mixture of countries and the like. Because like you, I have a funny feeling that we could even go back to things like licence fees, which is what they were.
Well, as I said, I got 2 good lawyers who know the Constitution to give me advice, and John Daly, our CEO at Grattan, also happens to know something about this because he was an associate to the judge who wrote the case. So, you know, my best efforts, I couldn't get anything reasonable, into the report. But then subsequently, I thought of this payroll tax idea.
Yeah, I think it would be really interesting, and because if we can leapfrog in that way, particularly with the changes that are going on politically across Australia at the moment, there's the potential to have synergy between the states.
Can I just add one thing to that? Because I think the other area where you can see price change without legislation is, again, as I was talking through the different community organisations. So one of the areas I was talking about before, in a more disadvantaged area, cities of Wyndham and Melton, one of the sport and rec centres there, off their own bat, before there was any kind of strategic intervention, realised that the price of bottled water was prohibitive to their community attendance. And so they've put a price fix on bottled water just off their own bat because they saw that as an equitable and healthy thing to do. So we're trying to evaluate that as well, which would be great evidence going forward. But I think there are lots of ways, once you start to get that community thinking about what they can do from their perspective, to drive those price shifts.
I think... Sorry, can I ask? I agree that economics is the way to go. I think it's very powerful and speaks strongly, and I think obesity has major health impacts. What I'd like to ask Dr. Duckett is whether you considered the cost of dental impact of sugary drinks, and if you had, would we knock that ball out of the park?
So we were only looking at the cost to taxpayers, and the Commonwealth taxpayer subsidy to dental is very indirect, and most of it's for private health insurance. But I don't think Trent's in the room. Did we look at? It wasn't in the modelling.
Another question, if I may, on that community costs. I'd like to know what you included in the health costs, because I've seen some work suggesting that looking at lifetime health costs, a significant amount of lifetime health cost is cost of dementia care, and if people have lower life expectancy, costs of dementia care tend to be less. So if you're looking at lifetime health, well, it is a question. Have you looked at that issue, and is lifetime health costs an issue?
So dementia costs would impact both in medical costs and hospital costs, and they're already included, and also in aged care costs, because people with dementia have higher use of residential aged care facilities, but we didn't take into account residential aged care costs in our cost estimates. It was just health costs. That's right, yeah.
I was wondering whether there's so many countries and places that you nominated that have been successful in getting beyond the vested interests that seem to be so powerful here. Why is that? Is there something that we can learn from all these different places that we could perhaps apply here in Australia?
So, David, as far as I understand it, the Coca-Cola and those soft drink manufacturers mounted huge campaigns and spent millions of dollars to try and prevent those community plebiscites getting up in the United States. And I think they did in some cities, so it's only the ones that were successful that we lifted up there. But I always go back to the cigarette case, where again there was mounting campaigns. There was, we didn't move from a situation of no cigarette tax and no cigarette regulation to where we are now. It was a slow process where community support was built for each initiative along the way, be it the tax initiatives or the regulation of sites of smoking and sites of sale, and the packaging label. So each of those was a step along the way, and each involved community support. So what I think we're seeing, and Anna is describing, is the community support is building there. What I experienced on the Alan Jones program, the community support is building there. So it's another example where the politicians are probably behind the community in where the community is prepared to go in terms of this area. So I suppose I could become more optimistic that it'll eventually get there.
Thanks, Anna and Stephen, for a couple of really wonderful presentations. I'll just go back to the dental question from before, as a dentist myself. I think that the whole issue of what's happening in sugar has to go beyond obesity. I think we hear obesity all of the time, and it's very easy to forget that dentistry is a huge issue, diabetes is a huge issue. We're seeing links with sugar and so many other diseases. We know 1 in 2 kids have tooth decay by the age of 6. We're putting thousands of kids under general anaesthetics each year, which is a huge cost to the public health system to extract a lot of teeth. The dental costs are around about $9 billion a year, and tooth decay is probably about half of that. So, I think it's important that when we're talking about these issues, that we bring everyone in together and we don't just focus on one particular disease, because I think we strengthen our argument to advocate for these sorts of measures, whether it's a tax or whether it's the sort of stuff that Anna's talking about around changing environments, that we're not talking about one problem, we're talking about a multitude of problems that are linked to sugar.
I agree, and you're absolutely right, and it's not only dental, and we should have highlighted the the dental issues. But it's, as with many of these things, it's if you're not only addressing obesity, but by addressing obesity, you're addressing multiple other conditions or issues as well. So I agree.
Oh, totally. I mean, I think, you know, you could frame the whole thing around healthy nutrition. And I think that's the way we should go. I think a lot of it's around whose attention you're going to catch at what point in time, but totally agree with being joined up. And, you know, all the sort of burden of disease data is around poor nutrition being the leading cause of disability adjusted life years. So that's a catch-all, totally.
So if someone has the mic, we've got time for one more question. If no one has the mic, it's now 7:15, which is when we're supposed to stop. Has someone got the mic or not? No. Brilliant. So thank you very much for attending. Thank you especially for attending on a day where you risk being drowned as you walk outside the door. Although it wasn't raining when we came in, who knows what's happening now. And thank you very much, Anna, for your presentation. I think there'll be a follow-up questionnaire that comes out to people who registered to ask what they thought about it and what else Grattan should do. And thank you to the State Library for the venue, which is really great. Thanks very much, everybody.